Welcome to Your Body at Its Best with your host, Craig Jenkins. Brought to you by Performance Medicine.
And a very good Wednesday morning to each and every one of you. Thanks for watching Local 8 News on the CW. Joined once again by Dr. Tom Rogers from Performance Medicine. Dr. Rogers, we have stated many times in talking to you, and I've said it publicly, finally, I got a doctor I can talk to. Because in today's medical world, I feel like I'm really rushed with other doctors, but with you, you take the time to explain things. What's so important about communicating effectively with your doctor?
That's a great point, because in today's world, with the way medicine is, you're very rushed when you go to the doctor's office for a visit. So you really have to take advantage and know how to talk to the doctor, what not to say. Really, because of EMR, because of insurances, because of the hassles of red tape with medicine, you're lucky to be able to spend 7 minutes with your doctor. So you better make the most of it.
At your practice, though, it's the complete opposite. It's more about taking the time to talk and inform the patient.
Right, because my practice doesn't deal with insurances or EMRs or coding. It gives me a chance to look the patient in the eye, spend a lot of time with them, maybe a half hour, sometimes an hour, and really help them.
It's important, I would assume, not to hide anything from your doctor. It's kind of like hiding something from your attorney.
Right, you want to be open and honest. You know, it's not going to go anywhere between you and the doctor. It's not going to go outside that thing, hopefully, unless your insurance gets involved and looks at a diagnosis, etc. But that's something for another topic. But one thing I will emphasize is that when you see your doctor, if you have that short period of time when you feel like you're rushed, the doctor has one hand on the door and ready to get out of the office, you know, bring one or two issues in at the most. The problem is, as doctors, when we see a patient and that has a list of 10 or 12 things, like they're dizzy, they have a headache, they're a little bit depressed, they have chest pain, their stomach's not working, the doctor's automatically going to say, you know, throw up his hands or his or her hands and say, gosh, this is a psych case. So one good tip is to bring one, maybe at the most two problems, have them fully addressed. And if you are lucky enough to get a yearly physical where the doctor can spend a lot of time with you, maybe more, but go in there with one or maybe two issues to solve and be happy with that.
It's not that way at Performance Medicine. Take your time with the staff there. Folks, there you have it. Another edition of Your Body at Its Best. Back with more right after this.